up, guys? It's Angel here with Nurse ED 101. Got a quick question for you. Are you struggling to pass your NCLEX? How's your clinical experiences been? Have they been mediocre? Have you had limited to no clinical experience? That could be the missing piece. You need real patience. You need to be in the setting that reflects the NCLEX. And a lot of those patients are in a hospital setting. And they're not mannequins, right? You need live experiences. Mr. Jones, it's time to take your temperature. Close your mouth, close your mouth. Mr. Jones, it's time to take your blood pressure. Oh boy, that ain't happening. Guess what? Mannequins are not gonna get the job done. We at Nurse ED 101 can get it done. And we can get you into clinical. We can get you exposed to those experiences. ER, ICU, med-surg, peds, maternity, Get in touch with us. We run clinicals every single month. Every single month, we can get you past NCLEX. That might just be the missing piece.